You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, rhinoplasty, what you need to know. If you don't like your nose, you have to hear what Dr. Chasan has to say. Board-certified plastic surgeon. He's San Diego's go-to plastic surgeon when you want natural results. Dr. Paul Chasan. Dr. Chasan, welcome to the program.
Well, thanks, Randy.
Now, we've had you on the program talking about a lot of different things. Now, for people that don't know you, they don't know your practice in Del Mar, who's your typical patient and what are the different procedures you do?
Well, Randy, I do the full spectrum of cosmetic surgery, and that includes facial rejuvenation, body contouring, breast surgery, and rhinoplasty. And really, the spectrum of age from male to female, from 16 all the way up to 82, that's my range of patients. So you know who comes to me? People who want to look good, people who want the best result, people who want to look natural. They want it done one time, they want it done right by a perfectionist. That's who comes to me.
Okay, so you are a perfectionist.
Yes, I am.
I looked at your website, by the way. Very nice. I mean, you have great before and after photos.
Well, thank you. That's a career of trying to do it better. That's all.
Now, you know, people need to know this is a real interview. I'm not endorsing you on the program, but you have great work. And do you think it's important that if you're going to choose a surgeon for any procedure, you got to look at their work? Because a lot of guys don't have a lot of photos.
Absolutely. In fact, I find myself, when somebody mentions a surgeon, I find myself looking at their website, and I figure if they're going to put their best results on their website, and sometimes I look at their websites and I'm like, really? Why would you put that picture on? I mean, if that's your best foot forward, and you know, there's some, and just for the audience, how do I determine if they're a good surgeon, if they're an artistic surgeon, or they have craftsmanship? Because there's a lot of craftsmanship in what we do. And you know, when you look at the body, you look at tummy tucks for craftsmanship. If you look at an incision and the incision doesn't look good, I mean, you can see that on the table. So if you're not built like little things don't bother you, and you can finish a case and it's not an excellent scar, it doesn't look good, and then you can show that picture, that means you're not particular. The craftsmanship of plastic surgery is very important. The incisions should be curvilinear. They should be fine scars. And the best time to do that is on the table. For artistic abilities, I look at breast lifts. For face, when I look at face lifts, for craftsmanship, I look, where's the sideburn? How's this part here is called the tragus, a very delicate part. Is that visible? So does the earlobe hang well? All those things are very artistic and craftsmanship oriented. So facelifts are more craftsmanship, and then noses is the most artistic part of what we do. It is. And so I look at noses to see their art.
Why is it so difficult?
Well, noses...
When you say difficult, do you mean to make it look good? To make it look natural?
All the above.
Okay.
Noses are the longest learning curve for surgeons because there's so many different dynamic forces going on, because there's half of a millimeter, a quarter of a millimeter makes a total difference. When you are in a nose, a lot of it is, believe it or not, it sounds silly, it's tinkering. You're rasping a little bit, you're taking off, you're looking how that fits their face, you're looking at the overall shape of the nose. Those teeny little millimeter differences make all the difference in the overall look. And will that nose look good on that person's face? Will it fit that person's face? Is it an attractive nose? Is it ethnically compatible with their face? And so all those little details make a big difference. So you have to be very, very detail oriented. And I'm built that way. I compete with myself how detail oriented I can be.
Is it the most artistic thing you do?
Yes. And so all this time, there's no slide rule you can take out and make that nose look a certain way. It's a look, and it's artistic, and then you have to put that in the big box of your experience. You have to be experienced with noses, because the noses change at 1 month and 3 months and a year, and you have to have that in your locker of how that nose is going to change from what you're doing right now. So even though you have a certain look that you're achieving, you have to coach that with how the nose and the dynamics of the nose will change in the next month, 2 months, and year. So if
that you could only get from experience.
Only experience. Nose is totally
you have to see it when it's
experience driven, and you have to see your noses, how they heal over time. And the longer I've been doing this, the more respect I have for the nasal skin envelope. So if you were to debone the nasal skin, you'd have a nose that has a certain amount of shape. And that shape, the more aggressive a person's shape, the more aggressive you have to structurize the nose so it doesn't go back to the old shape that it was. And so here you are doing this artistic thing still, and you're using all your tools and techniques and tricks, and still knowing that you have to structurize this nose a little bit more than that with certain grafts or suturing the nose. And so there's so many little techniques that are so subtle, it might even change a 0.5 millimeter. That's a huge change for me. And so to be able to put that all into my art, that's how I create an excellent and beautiful appearing nose.
Are there a lot of people, I asked you this in the green room, I said, are there really a lot of people that don't like their nose?
Oh, that's a huge number. I mean,
really?
And the funny thing about rhinoplasty and overall the appearance of someone's face, generally the misconception is if you have your nose done, it changes your whole face, and it couldn't be further from the truth. Really, having your nose done and removing the deformities or certain parts of your nose that you don't like, all it does is it shifts the attention and deflects that attention from your nose to the other positive features of your face. And I can't tell you how many beautiful women I see have beautiful features, the shape of their face, high cheekbones, great eyes, great lips, great teeth, everything, but they have a big hump on their nose. And that's what you see. That's all you see. And so you remove that hump, you make their nose look balanced with their face, and all the other features come alive. And it's a great transformation. Back to your original question, Randy, about do people not like their nose? And the fact is a lot of people don't like their nose, and they don't do anything about it. And they wake up every day and they don't like their nose. And I see so many women using makeup to hide the problems that they don't like about their nose. And you know, today, especially in today's environment, rhinoplasty is much more predictable. People are amazed at how quick the recovery is. In the old days, people would be black and blue for a month. Most of the time when I take off the splint at 5 or 6 days, they have a little bit of bruising. I can cover up with makeup, and they can go out to have lunch with their friends.
So if everything works out, you could do it on a Monday, be back to work the next week.
Absolutely.
Without an issue.
Yeah.
And they do that? Is that common?
That's very common.
Now, I want to mention one other thing, and again, I'm not trying to side with you, by the way. I've had you on the show before. I feel like I know you a little bit, but I have plastic surgeons on the show all the time. We've been airing now for 16 years all over the country, and I think the public doesn't realize most plastic surgeons most plastic surgeons don't like doing rhinoplasty.
Well, it's a frustration.
Isn't that true?
There are a lot. They feel frustrated. They feel trapped. They're stressed. They're doing a surgery that they're not comfortable with. And I've made rhinoplasty a surgery that I've excelled at. I've created, when you want to be good at something and you work to be good at something and you are critical of your own results and you learn a skill set and you develop that skill set to the point where now when I do a rhinoplasty, I go into a rhinoplasty, I know what I'm doing.
So they're easy for you. For you, they're
comfortable. I don't say anything's easy.
Okay.
I would say I know how to do rhinoplasties every aspect and am comfortable creating a beautiful nose. And I have all the tricks and skill sets to do that. Now, if you said, back to your question, do some doctors not like doing it? Yes, if you are stressed, you don't have those skill sets, your results aren't great, and patients aren't happy, you're not gonna be liking doing rhinoplasty.
I heard one guy say, you only get one chance to make the nose right.
Well, you're taking something and making it somewhat black and white. The best chance.
That means you got to be good.
The best chance is your first chance.
Okay.
After that, I do a lot of revisionary rhinoplasty. And again, to do a revisionary rhinoplasty, you really have to know how to do a rhinoplasty. And basically, when I do a revisionary rhinoplasty, I carefully open up everything, identify all the anatomy, and recreate the anatomy. However, there's always a little bit of scar tissue. It makes it more difficult. Was the previous surgeon, did they take cartilage? Did they remove cartilage? Did they cut the cartilages? And it's kind of like footprints on the moon. They're still there. You can see exactly what that last surgeon did. And so you recreate everything, and then you fix it the right way, with detail, with your skill set. using cartilage either from their septum, from their ear, from their rib. And having those techniques available and feeling confident at those and doing lots and lots of rhinoplasty is the only way that you can be comfortable with that. So who wants to go through a surgery twice? And we talked about that before. You want to be very careful when you pick your rhinoplasty surgeon. You want to look at their results. You want to make sure that they've been doing it a lot of years. They want to make sure that they do hundreds of rhinoplasties. And then you want to make sure that your aesthetics and their aesthetics are on. There's some busy rhinoplasty surgeons that I know, and I don't like their aesthetics. I look at their noses, and I know they're technically good surgeons, but when I look at their noses, I don't like them. That's it. I don't like them. They don't look good. So there may be people who look at mine and don't like them. That may be true. But hopefully you look at my noses and you say, hey, I want that guy to do my nose because I like his results.
On the consult, you're with a patient. What are you thinking? I mean, what are you trying to accomplish?
Well, when I look at someone's nose, I really am looking at my global gestalt of their face and seeing how much I'm looking at their nose. Am I looking at a bump? Am I looking at a retracted rim? Those are the things. And then in my mind, once I identify the things that catch my eye, just as a person, not as a plastic surgeon, just as a person, what catches my eye, then I start to narrow in on what are those things that are catching my eye. And then
do they tell you, by the way, most of the time?
Yeah.
I mean, don't they come in knowing what they hate about their nose?
Yeah, but a lot of times I point things out to them that they didn't really see, and I point that out to them, and they say, oh my God, you're right. What I do is I examine their nose, and I look for the dorsal hump, bulbous tip, retracted alar rim. Is the nose too long? Is the nose too short? Those are the things I'm looking at. Is it mild, moderate, or severe? So I have that category going in my head, and then I ask them the question.
Okay.
What don't you like about your nose? I already know what I don't like about their nose, but I want to make sure that I don't taint them and that I want to hear what they say, really. And that's where you sit back and you listen. And so I listen to them, and I'm really listening. And I'd say 90% of the time, what they're telling me is what I'm seeing. And then I look at them, I repeat what I think, and they say, oh, yeah, you're right. I don't like that either. Or, you know, I never noticed that, but you're totally right when we look at it very specifically. So I would say once we get this communication and really focusing on their nose, that's how I start to develop my plan. And that's how I can look at them, create the nose that they want, create an aesthetically beautiful nose, and one that fits their face.
And what do you do to let them know what it's going to look like? Just show them other patients?
I do.
Like noses from past patients?
I do. I get this question all the time. Do I do photo imaging? And I don't do photo imaging. And the reason I don't do photo imaging, it's too easy to, just by shaving a little off and taking a little off, it's too easy to show them almost a perfect nose that they can never achieve. And so what I rather do is show them my results, because I think
past patients with a similar nose.
I have, I've done hundreds of rhinoplasties. So I have pretty much every patient with every nose there is. And, the problem is you can give them a false sense of what they can achieve. You kind of take away the ability to judge you on your artistic ability. And so
they pick their
not
nose.
to.
Sometimes
Yes.
they say, I want that.
Yes. And so I've been doing this so long, I've gotten my skill set to the point where I can say, hey, do you like that nose? I can achieve that nose. Do you like a more refined nose? Do you want a more subtle change? And then we work from there, looking at pictures and picking out nose they like. And then I can say, I think I can catch a nose very close to that. Or, you know what? I think you're being a little unrealistic. That person is a blue-eyed blonde with thin skin, and you're Middle Eastern with ethnic skin. I can't achieve that nose for you. And that's the communication that I need to do. When I look at a person's face and I'm looking, they think I'm looking just at their nose, but I'm looking at their whole face. And the nose is, believe it or not, is one of the, changing someone's nose, improving their nose, is one of the most powerful things I can do to improve someone's beauty. And people don't really see that. Oh, I fixed my nose. yes, the misconception, you change their nose, their face changes. Not so much. You change their nose, their face beautifies very much. And the reason is that we look at things like a bump on a nose or a bulbous tip, and that's where our focus becomes. And I look at a woman, I'll see someone with a large dorsal hump or a nose that catches your eye. And then I'm looking at her face and seeing great cheekbones, great eyes, great lips, great shaped face. I know that she is going to have a home run. I know that she is going to look more beautiful. And I see it all the time. I have a picture here I want to show you.
Okay.
This is exactly that case where she came in, beautiful eyes, beautiful face, and her nose catches your eye. So here's a young lady who doesn't like her nose. And she's pretty, but she will not take a picture in the profile. Will not. She hates her profile. She hates the bump on her nose. She hates that her nostrils are elevated. And then even on the front view, you notice how she has what we call a bulbous tip, a wide tip. Now, I knew that I could achieve an excellent result with this person.
Do you ever get excited sometimes? Like you're there and you're going, boy, this is going to be good.
This is like a sport for me. It really is. I mean, well, you know, you develop a skill set, you enjoy what you do, you enjoy changing people's lives. This is a life changer. She's pretty, she has a fiance, he's a great guy. It's not, in this case, it's not like, oh my God, this is going to change my life. She didn't like her nose. She didn't like taking pictures of her nose. That's it. Sometimes that's all it is. So what I did is I removed the dorsal hump that she had. Now, her nose has a lot of structure, and the nasal skeleton, the skin, has a lot of structure. So I had to really be aggressive in placing grafts and cartilage to overcome that. And if you look at the rims of her nose, you see how they're pulled up and retracted? And
so the nostrils are kind of flared out.
They're flared out, and I don't like that look. And so I actually put grafts to control that, a graft to give her more of a defined tip, and then remove the dorsum in a very smooth and natural way. Now, look at the after. Look how that is balanced. Look how that fits her face. You can see she has a nice, smooth nasal contour, the flared nose that's turned down and a hump, and a turned down nose is now elevated. The nostrils look small and petite for her petite face. She has a straight nose. The tip is defined. I mean, it all looks like the nose she should have been born with. It's a balanced nose that fits her face. If you look at, instead of having a dorsal
That's a big
hump,
improvement, by the way.
Thank you. Instead of having a big hump on her nose and big nostrils that you definitely see and takes away from her beauty, you're seeing a nose that fits her face, it's pretty, that's straight, that doesn't have a bulbous tip. And when I look at that nose and I look at her face, I see beauty.
When it's all done, what do they say?
They're so thrilled. They are so thrilled. She loves taking pictures.
Like they should have done it years ago, some of them?
They all say that. I wish I did this years ago. You know, I see they wear makeup more. Why? Not to hide, to augment. They're more outgoing. I just see personalities just seem to jump out of the box. I love it. I love seeing these people. And I think in her case, she's only about 3 months out from her surgery. And look at that. So a little life lesson. I mean, when somebody looks in the mirror, likes what they see, if they take a picture and they like what they see, you know, that just improves their self-confidence. They feel good about themselves. The rest of their life, they have a gift. And you asked, do people wish they did it earlier? Absolutely. You know, there's always a reticence to have surgery. What's it going to look like? But when they have a before and after like that, and they can have that many more years to enjoy that. And one more thing, when somebody's confident, that's sexy. And you know what? That you can't. There's nothing that you can buy or pay. When somebody's confident, that's sexy.
That's good. Okay, so we have time for a few more photos.
Okay, so
good stuff, by the way.
Thank you. This patient is an actress and model.
Okay.
And she's very fit, beautiful lady, but she didn't like her nose. She didn't like the hump on her nose. She didn't feel like it was fit her face. She thought it was too bulbous on the front. And so for her, refining her nose, she wanted a refined look. She wanted to get rid of the hump on her nose. So what I did on her is I removed her dorsal hump and refined her tip. And it just changed her life. And
Very nice.
I think believe it or not, she just told me, this picture is only 2 months out, and she told me that she had an interview with a major magazine. They turned her down. They didn't like her nose. It's a beauty industry is a tough industry. And she told me that she just they saw her pictures again, and now she's coming back, and they actually called her for the interview.
Because of her nose?
Yeah, absolutely.
Because of the Dr. Chasan nose.
It is a Chasan signature
So when
nose.
I see women out there and they've got beautiful noses, they might be some of your patients.
Maybe you shouldn't even notice that. It should look like the nose that just a beautiful person. It shouldn't look like Dr. Chasan did their nose. It should look like that was the nose that they were born with.
Are the patients, you've been doing this a while, are they getting younger and younger, older and older? And when should somebody get this done?
You know, the age range starting around 16 is kind of the youngest that we do for rhinoplasty. And the reason is you want the facial skeleton to be mature. But I do rhinoplasty very commonly from high school to college transition, in the summers out of college. I do 30-year-old moms and even 60-year-olds, and I combine rhinoplasty with a facelift because as you get older, the nose gets longer and more droopy and the skin gets thicker, and so the nose continues to grow. So a lot of people that may have had a nice nose in their adolescence and 20s, by the time they're 60, they're having a
Give them a little lift on the nose.
And so you do a nose, you do the facelift, they look rejuvenated, and then it's bad if you have a rejuvenated face and a long, droopy tip. And so oftentimes I'll do a rhinoplasty in accordance with a facelift. Back to your question about when someone should get their nose done. It really depends on if they don't like their nose. But honestly, you can start having your nose done as early as 16. And realistically, that's...
So if you don't like your nose, do something about it.
You should.
Is that the way you feel?
Yeah, absolutely.
Okay.
Never before has the results been more reproducible, beautiful, lower recovery rates, consistency. So if you don't like your nose, there's no reason that you shouldn't get it done.
Okay, good. A couple more photos.
For example, this is a young lady. She's 19 years old. She has a very prominent nose. I mean, in this case, in her, all you see is her nose. On the front view, you see the nose not only is long and drooping, it's turned towards the right. And so it's crooked, and she has a very big dorsal hump. So with her, I wanted to remove the dorsal hump. I wanted to elevate the tip. And those are things that require a lot of surgical tricks. And
you've got some tricks.
Yeah, and straighten her nose,
good.
which isn't easy either. So I was able to do that. She has a very strong shape of her nose. And afterwards, I was really pleased how well we could make it balanced. It's straight, it fits her face, she's pretty. And talk about confidence. This girl, she has confidence now. So in this person, you can see that her nose is interfering with her beauty. And by removing the hump, making the nose balanced with her face, you can see she's beautiful. It just fits her face.
So parents get involved, by the way?
She came in with her mom. She came in with her mom and was very involved with her.
So if, to parents, if your children, adult, 19-year-old, 18-year-old, 16-year-old children are complaining about their nose, come in for a consult.
I think I love that.
And do they always come in together?
Not always, but very common. It's a very common age. From 16 to 20 is a very common age for me to see rhinoplasty. I'm going to share a few more stories.
All right.
And this is kind of a routine nose that just changed her beauty. And if you look at this one, she's in her 30s, didn't like her nose, and you could see in the before, she's got a bulbous tip, a wide tip, a dorsal hump, a long nose, and she has a pretty face. In fact, funny, about a week before her surgery, she called me and she said, "Do you really think I should do my nose?" And I said, "If you have the time and you have the money, you should do it." And she is completely thrilled.
Look at the difference, especially in the front view.
And again, it's a nose that fits her face. I'm going to show you another one. And you can see it. Each one of these noses is different. That's the art of what I do. Each nose is different. Now here's a woman in her 20s. She has a wide nose. You see, it's a very wide nose. The profile isn't awful, but is a very wide nose. It really bothered her. And so I was able to narrow her nose. And sometimes you just narrow the tip. Sometimes
Looks really good, by the way.
Thank you.
I keep saying this, but going into this, I was thinking, it's just the nose, right? And you told me in my green room, it enhances, makes them look prettier.
It really does.
And I was skeptical, because I don't really look at this stuff the way, and it does. This is a case where this gal looks much more beautiful.
Yeah, I'm gonna
Just
show
her
you,
nose.
I'm going to show you another one.
Okay.
This one is a subtle rhinoplasty. Some rhinoplasties, you see the big before, the rhinoplasty, the big dorsal hump. This one's pretty subtle. She wasn't all that bad, and she had a subtle dorsal hump that she didn't like. But if you see the before, and then you see the after, she does look more pretty. There's no question. Just by doing her nose, she's much more pretty. Randy, 2 more photos.
All right.
Because
you have to rush them a little bit. We got about a minute left.
Okay, because women aren't the only ones who benefit from rhinoplasty, but men. And I'm seeing more and more men benefit from rhinoplasty. And here's a young man who he had a significant dorsal hump, drooping tip, what we call under-projecting tip, fairly big nostrils. And in him, I removed the dorsal hump. He wanted a very refined nose, so I was able to give him a very refined nose, and he is thrilled. He's a handsome young man.
Looks good.
He looks
good.
great. I'm going to show you one more. And this man, Middle Eastern, tougher because Middle Eastern skin, they have thicker skin. You have to do more. And you can see in him, dorsal hump, big flared nostrils. He almost looks angry because
flared nostrils.
Yeah, you see that on cartoons. The flared nostrils make
like a bull or something.
Yeah,
when
and so
mad.
softening that, making his nose fit his face. He's a handsome man, and that makes him. I just think it makes him more handsome.
You're right. It's a softer, friendlier look in the after.
Right. So overall, I love doing rhinoplasty. It's detail oriented. It's something that takes a long time to develop, but the benefits to these patients is more attractive, more confidence. And you keep asking about like ages, and I think from any age, if you don't like your nose, you can have it fixed. You can make it look better. You can feel better, and that's the message.
All right, good. I want to thank you so much. And you have a lot more photos on your website. They can
do.
go to your website, take a look there.
I do.
Dr. Chasan, we're out of time. Always a pleasure to have you on the program. Thanks again.
Thank you.
All right. You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.